Hi there, everybody. This is Rizwan Chowdhury. I'm delighted for you to be joined here by Rohan Thakur, who is Vice President for Life-Science Mass Spectrometry from Bruker, who's going to talk to me about some of the developments they announced yesterday at their virtual press conference at ASMS 2020. So, Rohan, lovely to see you. I hear you've got up very early, 7 a.m. in California, and you've kindly joined me to give me an update on what's happening at Bruker. Thank you very much.
Thanks for the opportunity, Rizwan. Pleasure.
Right. So my first question for you, Rohan, is obviously the last time we spoke was actually in Atlanta, well, last year at ASMS 2019, very different circumstances. So how has COVID-19 impacted Bruker's business?
Right. So from a business perspective, we work very closely with academia. So academic budgets are something that we are following. In fact, in Europe, it's been robust because people want to buy our instruments for scientific research that's related to COVID. And we have our timsTOF Pro platforms actually working in this specific space. The industry, it requires us to be at conferences, meeting, sharing examples. So sitting at home and doing a lot of WebExes, it's a shift, definitely a shift. So
Right.
I would say we would welcome the travel and meeting with people. I think it's required in our industry.
Right. Okay. So moving on to ASMS 2020 and obviously the announcements you made yesterday. For those people who weren't fortunate enough to be part of the press conference, can you share some of the highlights with the audience as to some of the things that you talked about yesterday?
Yeah, I'd love to. Yeah, one big launch for us was the MALDI-2 post-ionization. So,
Right.
the last time a advance was made in ionization was when Koichi Tanaka and John Fenn won the Nobel Prize, and that was almost 18 years ago.
Right. Okay.
So the MALDI-2 does represent a dramatic improvement in sensitivity, in many cases, 2 orders of magnitude improvement in sensitivity and wider classes of compounds that MALDI can analyze. And if you look at Bruker, I think what we are trying to do in life sciences mass spec is connect tissue analysis, to cells within that tissue and then connect that to body fluids. So it's the whole continuum. And I think that's the exciting part. And not many are doing the tissue to body fluids continuum.
Right.
So I think that's new from us at ASMS.
Fantastic. Okay. And looking at the MALDI-2 then, can that be used then as part of the COVID-19 research which is out there trying to look for vaccines and drugs around that?
Yeah, it's definitely moving in that direction. There is a company that we're working very closely with called Adaptrix. And if you go to our website, you'll see a presentation from them. So it's called BAMS, or Bead-Assisted MALDI Mass Spectrometry.
Right.
And they use beads to pull down specific proteins and peptides, from the virus itself to do the analysis on the MALDI-TOF. So that's kind of an exciting development for us. And also looking at the phenotypical response of patients to drugs. So there are lots of areas where these products can be valuable in high throughput analysis and so on and so forth.
Fantastic. Okay. And when will the MALDI-2 be available within the market?
So we start shipping in early Q4.
Right. Okay.
So that's the plan. Yeah, it's available for sale immediately. But the first shipments will start towards the end of Q3. I would say in September, October, the first ones will start to get out.
All right, brilliant. And looking towards the future, what do you see any trends developing within this area for the future, and areas that Bruker are sort of investigating at the moment?
Sure. I mean, one key trend we see is metabolite ID in tissue. So they're looking for endogenous markers for cell cytotoxicity. And there are lots of studies now that have started to look at small molecule metabolites within tissue. So previously it was lipids and proteins and glycans. And now you're looking at just the metabolites that are naturally occurring as markers for cell death and stuff like that. So that trend we're definitely picking up. And the fact that biopsies are not going down in
Right.
life. So you got a lot of fine needle biopsies. Just regular for oncology, this kind of technology would be godsend, because you do want to look at tissue, because that's where you need to investigate scientifically and go deeper. So I think the trends are going to be start looking at tissue, just not body fluids or leakage products from
Right.
the tissue, but the tumors itself, and we can assist over there.
Fantastic. All right. Well, look, I know it's very early for you, as I said, so I appreciate taking the time out to give me this brief update on what Bruker have been
Sure.
doing. I hope you stay safe and well. Thank you very much for your time there, Rohan. And
Thank
to
you,
everyone
Rizwan.
watching, thank you for watching. I hope you found that useful. If you'd like to know more information about what Bruker are doing, there are links to the press releases above this video in the comment box. So until next time, stay safe and stay well, and I'll hopefully see you soon. Thanks a lot.
Thank
Take
you.
care, Rohan. Bye.